What saddens you may cost. Your mind, the difference between mental and psychological disorders. Since 1949, the month of May has been designated as Mental Health Awareness and Education Month. This tradition began with the American Mental Health Organization's efforts to reduce stigma and support patients and their families. The goal is to decrease suicide rates and raise awareness about negative behaviors and misconceptions surrounding mental illness. Several organizations worldwide have joined this initiative to promote awareness. To raise awareness about mental illness, it's essential to distinguish between mental and psychological disorders. Many people confuse the two terms, and in some societies, there is a stigma associated with mental illness, often described as madness. Historically, mental and psychological disorders were often attributed to malevolent spirits or demonic possession. Patients were ostracized and sometimes even killed to rid them of these perceived evil influences. There is no clear boundary between mental and psychological disorders because they often influence each other. A psychological disorder, such as obsessive-compulsive disorder, OCD, or depression, can develop into a mental disorder, and vice versa. Psychologists tend to use the term psychological disorders to encompass both psychological and mental illnesses. However, some specialists differentiate between the two based on their origins. Psychological disorders arise functionally, while mental disorders result from central nervous system dysfunction. For instance, depression is a psychological disorder that affects emotions, mood, and outlook on life. In contrast, schizophrenia, which includes hallucinations and delusions, is considered a mental disorder. However, the distinction is not always straightforward. Recognizing and denying the illness differ between mental and psychological patients. A psychologically affected individual is self-aware and may seek treatment. In contrast, a mentally ill person often denies their condition, believing that those urging treatment are the ones who need help. Treating mental illness is challenging, even if family members have it, as patients may not adhere to medical instructions, especially regarding encouraging medication. Mental and psychological disorders require full awareness from both patients and their families, as treatment often involves long-term medication use. Types of psychological and mental disorders include schizophrenia, paranoia, megalomania, and depression. These disorders may initially present as psychological, but can develop into irreversible mental conditions. Anxiety, on the other hand, is primarily a psychological disorder related to emotions and overall mood. Remember that even a mentally healthy person can lose their mind without a clear scientific reason. If any of these symptoms persist for 2 weeks or impair an individual's ability to perform daily tasks, immediate medical intervention is necessary. The causes of mental and psychological illnesses remain elusive, but 2 main factors contribute to their development. 1. Genetics. These disorders are more likely to appear in families where ancestors or parents have experienced them, suggesting a hereditary link. 2. Environment. The environment plays a role in the emergence of psychological and mental disorders. For example, a child growing up with a depressed parent may be more susceptible to psychological issues. If left untreated, these issues can progress to mental disorders. In summary, mental health awareness is crucial, and understanding the nuances between psychological and mental disorders helps reduce stigma and promote early intervention. Simplicity and science has not found clear reasons. The human psyche is very complex, and science in front of it, no matter how advanced it is weak. He pointed to post-traumatic stress disorder, which is a mental illness that was discovered during World War II, when it was found that soldiers returning from the war had developed diseases, and they showed severe changes such as excessive nervousness, desire to destroy, anxiety, and sleep. Science discovered at that time that a normal person can, in a certain moment of shock, lose his mind and turn into a mental patient. In some cases, he can be treated and healed, and in other cases, he can lose his mind forever.